Hello, I'm Shaddy Saba. I'm an assistant professor at the NYU Silver School of Social Work. I'm excited to share a little bit more about this paper called Patients Use AI, Clinicians Should Ask How, which is a paper that I co-wrote with my colleague, Dr. Bill Weeks. So the inspiration for this paper really came out of the classroom. I direct a postmaster certificate program on AI in social work and mental health. And a lot of what we go over in the class is oriented around AI tools that are being developed specifically for clinicians or for mental health use cases. So things like documentation tools, specialized mental health chatbots, AI scribes, things like that. But one of the things that kept coming up from the clinician students in the course was something a little bit different. They were telling me again and again that what was really kind of present for them was that patients were using mainstream consumer tools, so things like ChatGPT, Claude, Gemini, for things like processing difficult relationships, working through mental health symptoms between sessions, dealing with stress. And so these clinicians, even though they were relatively engaged in this topic, they were unsure about, how should I respond to these clients? What stance should I take about their use of AI? And so I looked to the literature and saw the same gap broadly. So professional organizations and researchers were putting out really thoughtful guidelines about how clinicians themselves should use AI, but they weren't saying very much about how we should respond to the millions of people who are already using these mainstream AI tools for their mental health. So the idea for this paper started to take shape initially as a role play exercise in this class. We practiced person-centered conversations that clinicians could go on and have with their patients about their use of mainstream AI. And so from there, Bill and I continued to talk and we honed it into what became this paper. So what we think is new here is really a reframe of some existing principles. We're drawing on person-centered practices that have been studied and refined for decades. The same kinds of skills that guide how we talk with patients about things like substance use, relationships, really any meaningful behavior in their life. And we're applying this to a new context. So in this paper, we kind of lay out a simple frame that's built on these principles. Introduce the topic, normalize, ask about benefits because patients really might be getting some benefits and there's a lot to learn about what's important and challenging and useful to them. We also want to ask about what might be concerning and be ready to share information about specific risks that we might be aware of. Finally, want to kind of keep the channel open over time as the technology and patients' use of it evolves over time. And so the take-home message is actually pretty hopeful. Clinicians already have most of these skills that they need to have these conversations. Asking patients about AI use isn't a brand new clinical skill. It's well established in the sense that it's, the way that you would have conversations about any kind of behaviors apply to this new one. And so I think that the sooner that clinicians and social workers start treating it this way, the better care that we'll be able to provide.